All right. Well, thank y'all so much for hopping on today. For those who are watching the playback, my name is Mollie Walker. I'm co-founder of Tennessee Fertility Advocates, along with Lauren Brown, who's on the call. And we're just really excited to have you here. This is a big week for infertility in general, as it's National Infertility Awareness Week, starting today, Sunday, April 23rd, and it goes through Saturday. So we wanted to just have a call. It's been a while, quite some time since we've done one, and just talk a little bit about what we are here for, why we exist, National Infertility Awareness Week, and maybe how you can get involved. And then lastly, we have a special guest, Jan Brackett, a personal dear friend that I love so much, and she's with Progyny, and she's going to tell us a little bit about adding, talking to your employers about the need for coverage and just sharing some things that Progyny offers, and just excited to have her with us. So let me just get started. I'm going to share my screen, see if hopefully this works okay. Okay, y'all see my screen? Yep, you see it? Cool. Okay, so let's see if I can hit next here. All right, so there's a few things I think are important to know. So National Infertility Awareness Week actually started in 1989 by Resolve. And the biggest thing on this is honestly just to speak up and educate others about the need for infertility coverage in the workplace and with our legislators. And some of the things that you can do, I'll be sharing on the next screen, but you'll see here, there's just a few different hashtags that you can use. This year, they're doing Find Your Voice in NIAW 2023. And then also I'll be sharing these slides on our Facebook group, because they do have some really helpful links that have so much good information on there. So that's just kind of the background, and it's really just to empower us all to change that conversation around infertility. You know, that's one of the biggest frustrations, and one of the reasons Lauren and I started TFA was because of the fact that, you know, no one talks about infertility and that stigma around it. And we wanted to have a community, they're just in support. And so super important to us to speak out about it and create awareness. So their Resolve's 5-day challenge, and if you click on that link, it will take you there. It starts tomorrow. And I know this is kind of a lot to read, but again, I will share it. So tomorrow, Monday, day one is what they're calling Voices of Infertility. Just talking about what will you have to say, share your truth on your feed, real story, anything that talks about just the barriers that you faced, accessing treatment, what it's like to have a life without children, and then maybe your hopes and dreams, around that. It's really just however you choose to make it, that is what that day is. The next one is Use Your Voice. So Tuesday is actually Federal Advocacy Day with Resolve. So for those who have signed up to attend Resolve's Advocacy Day, that is all about getting infertility coverage and why it's important to have that infertility coverage. I know so many of us, so many stories that I've read and so many people I've talked to, cost is truly like the number one barrier to seeking treatment. And it is really so unfair, honestly, to not have coverage for this disease. So day 3, it says wear orange. So orange is like the color they have for National Infertility Awareness Week and infertility in general. And Resolve does a great job about talking about the reason behind that. And again, it's on that link above. Day 4, it's where do you pull your support from? Who supports you? Is it a friend, a support group, an online community? And just elevate the voices of support in your life. So just be thinking about, where do you find support? If you have already been through infertility and you are on the other side and you have children, whether from fostering, adopting, you have your own children, whatever that looks like, just go back to that feeling of what was that space like for you? Where did you find support? Hopefully it's through a lot of connections in our advocacy group. Hopefully you have a close group of friends or family, perhaps, but many of us don't. So I think any resources and anything that we can do just to uplift and share about our community or our support group is huge. And perhaps maybe the goal of all of this is that someone will see it and be like, oh my gosh, I'm struggling too. And like, I'm not alone. So that's something really, really important for us as well. And then lastly, day 5 is Friday. And that is called Find Your Voice. And there's so many ways to find your voice and owning up, your story. Now, some people I do realize do not feel comfortable with sharing their story, and that's okay too. But if you do, again, you can share that openly. Friday as they kind of end out that 5-day challenge. And then it says, be sure to tag Resolve in your post. Feel free to tag TM Fertility Advocates. We always love that. There is some cool little filters that you can use. So if you go to Resolve's Instagram page, you click on these 3 little stars that are kind of circled here, you can pull up some of their filters. So I thought that was just a neat thing there and wanted to share. And then I love this from Progyny. Again, we'll hear a lot more from Jan about that, but with Progyny, they have a sign template that you can print out, and it looks like that on the right. And then they also have a blank one, so you can write whatever you want and have somebody either take your picture, post a photo of it, or they're even saying create a 1-minute video and include a short intro about yourself, perhaps your company, and then really just encouraging other companies to add fertility benefits. And so if you post it during the week, this is talking about on LinkedIn specifically, but you could honestly post it on anything, even if you're not on LinkedIn. Be sure you tag Progyny. They will repost and share your message. But again, infertility affects so many, and talking about it and supporting, others going through it is huge. So I loved that as well. And we'll be sharing it in our Facebook group. A few other social media events. If you go to Resolve's website, and Progyny's too. Resolve's actually, they're doing 2 Instagram lives. One is on Monday, one is on Thursday. And let's see, Monday, it's just making the leap from your OB to your infertility specialist and how to prepare emotionally for your first visit. Tuesday is, like I said, Federal Advocacy Day. Wednesday is Progyny is doing one. You just register, it's free. And if you miss it, they'll send you the recording. But it is called A Balancing Act, Navigating Work and Fertility Treatments. And then Thursday is doing another one, and it is going to be live on Instagram, The Importance of Finding Mental and Emotional Support During Your Infertility Journey. And then there's another one here. If you go to this link here, there's a bunch. I'm not going to read through all of them. But again, it's just, there's a lot of different webinars, a lot of free resources that during this time, some might not know about. So I just wanted to post those. And again, I'll share it when I share the slides. And then another thing I did yesterday is I just kind of updated we have obviously our Tennessee Fertility Advocates Facebook group. If you go to the files tab on there, I circled it here, but if you click on this infertility resources doc, there it has tons of great tips, websites, books, scripture, songs, blogs, therapists, support communities, you name it, it's on there. And if y'all have any recommendations that need to be added, let me know. But that's kind of, once you open files, these are different files that we have. And then I checked this other one we did during kind of COVID for sure. We did Warrior Wednesday videos, and all of the links of our videos are there. And I'll be adding this video to that as well, and our Facebook group. But just wanted y'all to know, if you didn't, that we do have a bunch of resources out there, and hopefully you find those helpful. And then really the other thing is, we just wanted to have Jan on, who Jan is so fantastic. And I absolutely love Progyny. I actually have had quite a few meetings with Jan and some employers about the need for coverage. And I know she has been working very hard with some large employers to really work on, spreading awareness about infertility and how much infertility benefits would make such a huge, huge difference to employers and employees. And I am just going to, she needs no introduction because she's so fantastic, but Jan is joining us from DC, and just excited to have her on. And just, Jan, if you would just kind of talk to us a little bit about what Progyny does, about the best way that if somebody's watching this and they have no infertility coverage, what do they do first? Like, what do you recommend is the best steps? And just any tips and things that you have.
Well, Mollie, it goes both ways. I think you're amazing. So I'm grateful to know you and to be able to help get to work with Tennessee Fertility Advocates. But at Progyny, we really do something that's extremely special. Our mission is to make any parents or any member's dream of parenthood a reality. And when Progyny started, it's been about 7 years ago. We saw that, first of all, infertility is deemed a disease by the American Medical Association, but it's still not routinely covered by a lot of employers' health plans. And so just because it's not covered doesn't mean that people aren't going through it. So infertility is now impacting 1 in 5 women is impacted by infertility. 1 in 8 couples is impacted by infertility. And infertility affects Black women twice as often. It impacts Black women twice as often as it does others. And so it's something that needs to be added to health plans just because it's a disease and it should be covered. And when Progyny started, and the reason why it came to be is we saw that the way fertility was covered, if it was a covered benefit, was broken, and that the conventional benefit was either a dollar limit benefit or a reimbursement benefit. And there is no other disease that is out there that is covered that way. If someone were to have a cancer diagnosis, an employer is not going to say, well, you have $20,000 to treat your cancer, and after that, good luck. So why should infertility be treated in the same way? It absolutely should not. And so that's really why we came to be, is that we wanted to create a benefit that was equitable for everyone, that didn't have some kind of limit on it, that would create a model of scarcity where people were having to make decisions based on how much money or how much of a benefit they had in order to try to have a family. And so one of the things that we've been really able to share with employers, and I think that's an eye-opener for them, is to let them know that even if you're not covering this benefit today, your employees are still going through this. And when they're going through it, they're going to be making decisions that are not going to have the best outcome. And that's going to impact the employer's health plan and could potentially become a catastrophic claim. And so one of the things that I always tell people is that unfortunately there's still a stigma attached to it. I know Tennessee Fertility Advocates has done a really good job to help bring more awareness to infertility as a disease, but people a lot of times will hear HR leaders say, well, I don't hear anything about anybody in my company going through infertility. They never talk to me about it. So I would say the number one thing someone could do is, I know it may be hard, but really speak up and use your voice, kind of like what Rosalva said for this challenge this week. Let them know what you're going through. A lot of people don't realize that when they're going through infertility, it's as if they've been diagnosed with cancers, they're going through depression, and the amount of just emotional depression that causes someone, it's a lot. So I would make sure you let your benefits leaders and HR leaders know that this is something that's important to you. I would also, if you're comfortable, share your story with them. Let them know like what your story has been through, and everything from a financial standpoint, from a physical standpoint, from an emotional standpoint, what that's been for you, having to go through that while you've been still been an active employee at their company. And if you have any other colleagues that are going through something similar, I would encourage them to speak up as well, because I know in particular, just an example, St. Jude and Alsac, one of your Tennessee Fertility Advocate members, Sarah Barnes, did an amazing job at not only advocating for herself, but getting her colleagues to advocate too. And I think that was played a huge role in them adding coverage. So I think your voice matters, and getting other people to speak their mind. And, even if it's a friend who sees you go through something, they would, if they're willing to speak up too, that it's huge.
I think definitely Sarah, Dr. K, they all did so good at getting all their coworkers just to all email at the same time. And I feel like that is truly key. I mean, one person, I know another company here that because of one person asking, they added the benefit, but some companies, they might say, hey, well, that's just one person. we haven't heard from anybody else. And having numerous people speak up and say something is very helpful. And so your coworkers that you sit next to, goodness, like if multiple do, it makes such a huge difference.
Absolutely. So I would just definitely start there. And I think it's one of those things, I mean, especially as you're going through all this, like this is a marathon, it's not a sprint. These things do take a lot of times to get change to happen within your company, but you just got to keep with it and, don't give up, because you can make it happen. You can make the change, but it takes a long time sometimes. And I think with employers too, they are looking at changes to benefits maybe one time during the year. And so if it doesn't happen that first year, it may take the next year, but even if it's not going to potentially directly impact you, it's kind of that future, the future employees that might be going through this. You just got to keep on doing it, because at some point it's going to help somebody. And I think the other thing is, I think it's important for employers to know that there are a lot of companies that are offering this benefit. And chances are, if someone is going through this and their current employer is not offering it, their competitor down the street might be, or even if it's in a different industry. People are switching jobs now just to get this benefit. I had a gentleman reach out to me. He worked at a company that did not offer a fertility benefit. And I actually shared the list that you had compiled with, employers that were adding it. And his wife got a part-time job at Tractor Supply and is starting in June. And I'm like, people will, there are companies that see this as something that is really important to people. And if your company is not offering it, look and find one that is. So I would just say there's a lot that you can do. And you've done a great job at compiling so many resources. And I would also say Progyny's website, which I know you have linked, has a whole toolkit on how to talk to your employer. We've got templates that you can use if you're trying to kind of formulate, how do I tell my story in a concise way, but also from a just, financial impact. What does this mean from an employer? Because our biggest challenge that we hear is, well, we can't cover that. It's too much money as an employer. But what employers were sharing with them is that even if there's not an infertility benefit at your company today, fertility specialists are really creative at trying to get things covered. And so about 30% of the time when there's not a benefit today, we're seeing it covered through a company's medical plan. So we call it claims leakage, where things are getting coded a certain way so that fertility specialists are able to provide some amount of here's a way we could at least get an ultrasound covered or a consultation. So what companies don't realize is they're already paying for something today, even if they don't have a benefit. And we're trying to help protect them from those potential instances of twins and triplets that could lead to catastrophic claims. So people aren't having to make those choices of, do I have more than one embryo transferred because this is my only opportunity? Or do I not spend money on genetic testing that could lead to a miscarriage, or could lead to, if you carry a trait for a certain monogenic disease like sickle cell or Tay-Sachs or cystic fibrosis, and then you don't want to pass that on to your child, do you forego that testing? So we're trying to really educate and show that there are some ways that this benefit is really protecting the employer's plan from potential catastrophic claims. So I know there's a lot of extra information, but I think there's a lot of things that people don't understand when they're going through infertility that could impact an employer's health plan and in the way of a catastrophic claim.
Yeah. And Progyny, I think it's good to note that is really like an added benefit on top of the Blue Cross Blue Shield, or it doesn't replace, it's not replacing normal healthcare plans. And what I love so much is Progyny has a great website that you can put in they can put in their information about their employer, and Progyny can actually reach out and say, hey, we've heard from someone at your employer. If you don't feel comfortable, would you say?
Absolutely.
Jan? Yeah,
absolutely. And you can say I don't want anybody to know at my company that I've reached out, and we will just reach out on our own and just, definitely there's ways to do that if you're not comfortable doing that yet.
Yeah. But if you are comfortable, I always say, if you reach out to the HR department, I don't know about y'all, but at my employer, it's a large department and we have an Ask HR inbox. that's probably not the person that's going to be making the benefits decision. And so sometimes that might just look like, hey, picking up the phone and reaching out to HR and just asking them who is over the benefits group, and get that name and number of that person, or get that email address, or send it to the HR and then follow up to make sure that the right person has perhaps gotten it. Because, sometimes it's not just sending it to just the generic HR group. It might take a little bit more kind of research into who's actually going to see this and make a decision. And one thing I loved when I was reaching out to legislators is, when you do send that email or you do talk about your story, include a picture. I think it is powerful. Put it in the body of the email at the bottom. It doesn't have to be huge or anything like that, but let them see, like, this is who I am. If you're married or have a spouse and you want to put that on there, then by all means. Or perhaps you have secondary infertility and you've really wanting to have a second, that is important to show too. Like, we're wanting to build a family. So I don't know what Jan thinks about that, but
No, I think that's all great.
I do like a good personal reference kind of just behind it of, this is like, I'm an employee here. And like she said, there's down the street, there's tons of other companies that perhaps are offering it. And we do have a list of just employers that we've heard that do offer infertility coverage. And one of the things I love about Progyny is, if you find a company that offers Progyny, I call it the gold standard of infertility coverage, because how amazing their smart cycles are. And that can be for a whole nother conversation, or if you want to just hit on the highlights, Jan, I don't know, whatever you think.
Well,
the biggest thing is we want the short story to be told.
Yeah, I think so. And I think one of the things that's unique about the fertility space in general is it is the only specialty that I know of where fertility specialists are required to report their outcomes to SART, which is the Society for Assisted Reproductive Technology. And that's a public website that anyone can go to. You can put in your doctor's name or your doctor's clinic, and it'll show you things like how many transfers have they done, what has their success rate been with single live births, or how many instances of multiples have they had. And so even if you don't have the Progyny benefit today, one of the things that I always encourage people is Progyny has curated the largest network of fertility specialists that are part of our network, and they are the best of the best. We invite them to be in our network. We make them go through very rigorous credentialing standards. They have to have performed at least 100 assisted reproductive technology cycles a year or more. And so on Progyny's website, this is open, free to the public. We have our provider locator, where you could go in and see exactly like, okay, where, you live, if it's in Memphis, Fertility Associates of Memphis, for example. But if you don't know where to go, if you're trying to find the best provider, you could easily look at Progyny's website and see who's in our network, and know that we've done the vetting of looking at all the providers in the country and only including those that have the best outcomes, meaning best chance for successful pregnancy, fewer instances of miscarriage. And so that way, at least if you don't have a benefit yet, you can at least know that we vetted all those providers to know that only the best are included in our network. So if you're not really sure where to start, that may be something you could do. The other thing that's unique to our benefit is, as Mollie mentioned, the smart cycles. So we've taken away that concept of a dollar limit or reimbursement benefit and replaced it with a bundle of all the necessary treatments. And we don't require that someone has to have tried, let's say, artificial insemination 5 times before they could get to in vitro fertilization. Our doctors are able to provide the best treatment the first time. So they need fewer treatments, less medication to have successful pregnancies, and there are fewer instances of miscarriages. So at least if you don't have the benefit today, you could at least start with our provider network and know that our providers are going to be the best ones that are in the country. Because there are some that probably, their outcomes are not good, and that's why we don't include them in our network.
So good. So good. Let's see, what else, Jan? Is there anything else that would be helpful that you think it would be good for them to know when thinking about talking to your employer? Or say they want to reach out, or they have a question or something like that. What's the best way to kind of do that? Is it best to go to the website, reach out to you? What do you suggest?
I mean, you can always share my contact information if they don't want to reach out through the website, if they want to have like an actual person. And
Yeah.
I'm always available to provide any type of resources, like the same templates and things like that you would see on the website. But I know sometimes it's nice just to have like a
Yeah. It's so
person
easy.
yeah. So I'm
Yeah.
always available to help. If you want to share my contact information, you can absolutely do that. If you're wanting us, to reach out and you want to go to the website, you can easily say there's a talk to your employer on the progyny.com website, and you can fill out that form. I would just say the biggest thing is don't be shy about the need, like ask for the benefit. And the more companies hear about that from their employees asking for it, it really does make a difference.
Yeah.
So I think that's the biggest thing is just share your story, because it's so, I know you always say, and it's so true, is if you've been struggling, this is a way you could turn your pain into a purpose.
Yes.
And that's one of the biggest things that's going to really help to get that out there, because people don't know if you don't share your story.
Yeah, man, so good. So good. And I think, just recapping, just that mental health side, the personal stress, the emotional stress. I know when I found out I was going to have to go see a fertility doctor, the first thing I did was spend time figuring out how am I going to pay for this and how much time that takes away from just me to be productive at work, because I'm thinking about all of these other things, and Progyny offers just such incredible care from start to finish. And it's just truly the best. So very, very thankful for all the resources y'all have.
The nicest thing that we always hear is that before a company has Progyny and you've got to go to the fertility specialist, and I know that all of you can attest to this, probably the first place you go is to the finance office if you don't have a benefit of how are you going to pay for this. When someone has Progyny, they don't have to do any of that. They make you don't pay anything at the time of your visit. There are no copays. You can really focus on your journey and getting to that best treatment. And that's what we're here to do, is to take that burden off of all the other parts of it, so that you can really just focus on what are the best treatments I can do to get to a baby in the shortest amount of time and the healthiest way. So, I think for people to really understand, I think one of the things that we did recently is we did a clinic tour with Fertility Associates of Memphis, and took an employer there, and they were so amazed they don't realize all the things that people go through when you're going through treatments, of having to go there every day at 7 a.m. to have your blood checked and have an ultra. I mean, they just don't understand, and how you're able to fit that in through your day as you're trying to work and do all the things. So those are things that we always try to encourage. If we can take an employer into one of our clinics, so they can see, like, what is it like for a patient to go through this? And a lot of times people have no idea. And so we're able to then show them, without a benefit like Progyny, this is what your employees are going through. And with a benefit like Progyny, this is the difference. And it's just like, yeah. So I think there are things that we're always willing to do to try to show employers, this is what's happening. And you can make a change and make it better for employees that are going through this. It may not be that many, but for the ones that are going through it, it's life-changing, and so on so many levels.
Yeah, I think it's the biggest thing, is always say it's the best way to attract and retain top talent. I mean, it is so crucial. I know recently when I've been through to the fertility clinic, and many of y'all know, but we recently had a miscarriage, and going into the clinic and just seeing how many people are in the lobby, and just being reminded of, like, my goodness, like, this affects so many people. And we just honestly, I think if you don't know someone, or you aren't personally going through it, unless somebody brings it to your attention, you're not going to know, you're not going to have an idea. And so learning to just be vulnerable in that space, I think it takes time, because for so many years I didn't share. But once I got to a point where I was just done with that, it's probably been the most freeing thing for me personally, just to open up and say, this is what it is. Like, I believe God allowed me to go through this for a reason. And like you said, Jan, it's just giving your pain a purpose. And so it is a marathon. It's not a sprint. And for someone who's very impatient like myself, it is very hard and frustrating, but those reminders of following up on those emails and saying, hey, when can I check back in? Somebody might say, well, we're not looking to do benefits, and maybe open enrollment is in September, but maybe July is when they're really like getting down to the nitty gritty and figuring out what they're going to add or not. Well, follow up with them in July, follow back up and stay on top of it. And don't just think, okay, well, I never heard back. Well, find someone else that's going to respond, continue to reach out. Just same with your legislators. I mean, it's just so important to continue to raise awareness and speak up for yourself, but also the next generation. I mean, my kids, like, I want them to work somewhere that has coverage, because heaven forbid they have this awful disease, that they never have to go through the pain, the financial stress, and all of that comes with not being able to afford treatment. So, is there anything else that you have? I think we did a great job covering it.
Yeah, I think so
You did
too. I would just
amazing.
say, be the squeaky wheel. Like, don't.
Yes,
Yes. Yeah. But no,
absolutely.
I think you said it all.
Well, you did amazing. Does anybody that is on, if y'all have any questions, feel free to ask. And if not, then we'll just wrap it up. I don't know if there's any questions. Nope. Awesome. Well, Jan, thank you so much for your time. I hope you all will check out just kind of the resources, go to the challenge page, go to Resolve, go to Progyny. There's so many amazing toolkits, so much good templates, so many good information. But at the end of the day, it's your story and you just need to make it your own. And if we can help in any way, reach out to me, Lauren, anyone else, we're happy to do so. But thank you everybody for hopping on.
Thanks, Molly.
Thanks, Jan. Bye, y'all.
Bye.